So in this video, I'm going to talk about two free-living amoebic parasites, Acanthamoeba and Naegleria. I'm doing this series of videos for CNS infections, and Acanthamoeba and Naegleria definitely qualify. They are the most common cause of primary amoebic meningoencephalitis, so definitely hit the mark there. That's also known as PAM. That is not to say that these are the only parasites that cause encephalitis. Far from it. Particularly, you guys have already learned about T. gondii, the causative parasite behind toxoplasmosis. We learned about that back in host defense in your Miriam Kahn case. That is definitely a cause of encephalitis, particularly in pregnant women and elderly individuals. Get it from cats, kind of by way of cats. Acanthamoeba and Naegleria are definitely also important, but I don't want you to think that these are the only parasites that can cause encephalitis, because that is definitely not true. But they're the ones we're going to focus on here. Okay, so what are they? They're free-living amoebae. Found in soil and contaminated water. So what do I mean by contaminated water? Lakes, streams, other water environments. Most human infections with these amoebae actually occur during warm summer months, when people go and swim in contaminated water that might not be so healthy for them. So, go and swim in some dirty lake because you just want to cool off. Well, there might be Acanthamoeba and Naegleria there, so don't do that. Inhalation of the cysts is actually how you get it. So it kind of becomes aerosolized as you're, cannonballing into that beautiful lake that you're excited to swim in. You can also get it from dust that gets kicked up if the cysts are in the dust, and that can lead to some infections. You also may see ocular infections. Ocular infections with Acanthamoeba are actually associated with contaminated contact lenses. This is Acanthamoeba, so I'll write it over here. So patients who, didn't do a great job cleaning their contact lenses may experience some sort of Acanthamoeba ocular infection. Okay, so let's talk about the clinical syndrome. The main one that we're worried about is primary amoebic meningoencephalitis, or PAM. That's what I'm here. This one's really rapid, really fulminant, leads to destruction of brain tissue. Symptoms include kind of this intense frontal headache, sore throat, fever, blocked nose with kind of an altered sense of taste and smell, stiff neck, Koenig sign. The CSF is going to be purulent, and it might contain red blood cells, and it probably will contain the amoeba. So this one over here, this is Naegleria, this is Acanthamoeba. But, this would be obviously the amoeba form of it, so you might be able to detect it there. The clinical course is really rapid. Death normally occurs within 4 to 5 days of onset. We can diagnose it from a whole bunch of places. Nasal discharge, because remember, we've got that kind of altered sense of smell and taste. You can certainly find it in the CSF. Corneal scraping if we're worried about an ocular infection. Once again, you're going to need to use kind of weird stains because these are parasites. You're going to want to do a wet mount. Gemsa stain, you could try a gram stain, but you're probably not going to see much. A fluorescent stain like chalcophore white can be used. But even if you get, let's say you get down to that, looking at these two pictures, you might think it's fairly easy to tell them apart, but it kind of isn't. Naegleria and Acanthamoeba can look very similar to each other. They're difficult to differentiate unless you're really skilled at it, have been doing it for a long time. Post-mortem, if you look at the tissue, you're actually going to be able to find trophozoites for both of these. So that is definitely a diagnostic form for both Naegleria and Acanthamoeba. But for Naegleria, you're not going to find any evidence of the cysts. Acanthamoeba, you will find trophozoites and cysts. So infective form, cysts for both. Acanthamoeba, diagnostic form, trophozoite and cyst. Naegleria, diagnostic form, trophozoite. There are treatments for this, and if you identify it quickly and you treat it, it does increase survival, but it's not entirely effective. So this one is pretty rough. So don't go swimming in weird ponds.